Hello and welcome to the #Saves webinar series titled ABLE Eligibility and Interplay with Federal Benefits. I will be presenting today along with Marty Ford from the ARC of Texas. My name is Chris Rodriguez. I'm the director of the ABLE National Resource Center. ARC of the United States, I'm sorry. This webinar is brought to you by the ABLE National Resource Center and is sponsored by Ascensus. And before we get started today, I'm going to go over some of the technical aspects of being registered for the webinar and experiencing the webinar. So, the audio for today's webinar is being broadcast through your computer. Please make sure your speakers are turned on or your headphones are plugged in. You can control the audio broadcast via the audio broadcast panel. If you accidentally close the panel, you can reopen it by going to the Communicate menu on the top of your screen and choosing Join Audio Broadcast. If you do not have sound capabilities on your computer or prefer to listen by phone, the dial-in information is located on the right hand of this screen and included in your registration confirmation. Real-time captioning is provided during this webinar. The captions can be found in Media Viewer Panel, which appears in the lower right-hand corner of the webinar platform. If you want to make the Media Viewer Panel larger, you can choose to minimize other panels such as chat, Q&A, and/or participants. For submitting questions, please use the Q&A box to submit any questions you have during the webinar, and we will direct those questions accordingly during the Q&A portion. If you are listening by phone and not logged into the webinar, you may also ask questions by emailing questions to kauchenbach@ndi-inc.org. It is also important to note that the webinar is being recorded and the materials will be placed on the ABLE National Resource Center website at the following web address. If you experience any technical difficulties during the webinar, please use the chat box to send a message to the host, NDI Administrator, or you may also email kauchenbach@ndi-inc.org. Okay, so just briefly I want to introduce our presenters and guest panelists, starting with Marty Ford, who is the Senior Executive Officer of Public Policy at the ARC of the United States. The guest panelists include Kathleen McGrath, who's the former Pennsylvania State ABLE Program Director, and Rob Percival, who's the Senior Vice President of Strategic Products at Ascensus College Savings. During this webinar, we'll be covering what the ABLE National Resource Center is, a quick brief explanation of the #ABLEtoSave campaign. We'll talk just briefly about the ABLE basics in order to get a basic foundation about ABLE, and then we're going to dive into eligibility, both eligibility as it speaks to being enrolled in an ABLE program, and how eligibility for federally funded means-tested benefits could be affected by funds in an ABLE account. After that, we will talk about some different examples and go through some profiles of hypothetical situations of individuals who are interested in opening an ABLE account, and then we're going to turn to our guest panelists for some Q&A. Okay, so let's go ahead and get started. The ABLE National Resource Center is a collaborative whose supporters share the goal of accelerating the design and availability of ABLE accounts for the benefit of individuals with disabilities and their families. We bring together the investment, support, and resources of the country's largest and most influential national disability organizations, and you can learn more about the ABLE National Resource Center at our website at www.ablenrc.org. The ABLE National Resource Center, along with our 25-plus member organizations, have collaborated to establish the #ABLEtoSave campaign. The #ABLEtoSave campaign is a month-long marketing and informational campaign taking place throughout the month of August. The national campaign is spearheaded by the ABLE National Resource Center in collaboration with the Center's 25-plus national disability organizational members, state ABLE programs, financial institutions, and other ABLE-related stakeholders. The hashtag ABLEtoSave will strive to blanket the country with widespread information concerning all things related to ABLE, with the aim to significantly accelerate the opening of ABLE accounts by eligible individuals with disabilities and their families. Again, the goal of this campaign really is to increase awareness and education about ABLE accounts, and again, to accelerate the opening of these ABLE accounts nationwide, both in the short and long term, so that people with disabilities can take advantage of the vast benefits associated with having an ABLE account, and for many instances, being able to save funds for the first time without jeopardizing their benefits. The next slide takes you through just a brief outline of the campaign. We've broken down the month into 5 different topics, of which consist of basic overview of ABLE, which we discussed last week, different topics related to eligibility, which we're discussing this week. Next week's topics will speak to what are qualified disability-related expenses. Then we'll move into financial literacy and ABLE and how that corresponds. And then lastly, the last week, we'll talk about the logistics behind enrollment, and hopefully that will serve as a miniature enrollment drive. So we're very excited about that, and we hope that everybody on this webinar will also be participating in the following webinars over the next month. Okay. So let's just very quickly talk about, give a brief history of the ABLE Act and some of the basic characteristics before we really dive into eligibility topics. The Stephen Beck Jr. Achieving a Better Life Experience, or ABLE Act, amends the federal tax code to add section 529A, and what it basically does is it creates a new option for eligible people with disabilities to save money in a tax-exempt account that may be used for qualified disability expenses while still keeping their eligibility for federal public benefits. Just very quickly, some basic characteristics that will be consistent across all ABLE programs include that there are eligibility requirements related to opening an ABLE account that speak to the age in which the individual first experienced his or her disability and related to the severity of such disability. And this is really what we're going to be diving into today to help folks really understand exactly what those eligibility requirements look like and what they consist of. So that's what the bulk of this presentation will be on. Additionally, basic characteristics also include the fact that an eligible individual is not obligated to enroll in their state of residency, meaning regardless of where you live, you are able, provided that you meet the criteria that we're going to be discussing later, you can enroll into a program that's based outside of the state that you actually live in. Also, the designated beneficiary is the account owner, although if that individual has been deemed not to have the capacity to oversee the account, or if they wish not to and have somebody else, there are 3 types of individuals currently that can have what's called signature authority or exercise authority over the account on behalf of the beneficiary, and that includes a parent, a guardian, or a person with power of attorney. Funds in an ABLE account can be used, are obligated to be used for what's called qualified disability-related expenses, and next week we're going to be diving into exactly what that consists of, what those look like. And it's important to note that assets in and distributions for qualified disability-related expenses will be disregarded or given special treatment when determining eligibility for most federal means-tested benefits, including Social Security benefits and Medicaid. And we're going to be talking about that here in a little bit as well, kind of diving into what that consists of. Lastly, anybody can contribute into an ABLE account, including friends, family, and even the beneficiary themselves, perhaps as a result of compensation through employment. But it's important to note that all those contributions combined in any given tax year are not allowed to exceed $14,000. So with that, we've kind of talked briefly about what the ABLE National Resource Center is. We've given you a little description of what we have planned for hashtag ABLEtoSave, the public awareness campaign, and we've gone over just very briefly some basic components that are related to the ABLE Act. I want to turn it over now to Marty Ford from the ARC of the United States to talk about exactly what it means to be eligible to open up an ABLE account and to talk a little bit about how ABLE funds might interact with your federally funded means-tested benefits.
Great. Thank you, Chris. So first of all, who is eligible to be an ABLE account beneficiary? I'm going to give you the basics and then we'll go into detail on each of these elements. First, to be eligible, individuals must meet two requirements. The first is the age requirement. You must be disabled before age 26. And second, there is a requirement for severity of disability. And that includes that you have to have been determined to meet the disability requirements for Supplemental Security Income, or SSI, or the Social Security disability benefits of the Title II program of the Social Security Act. Or you have to submit a disability certification assuring that the individual holds documentation of disability and have a physician's diagnosis and signature confirming that the person meets the functional disability criteria of the Act, and that criteria is related to the severity of disability described in the Social Security Act for Title II or the SSI program. And as I said, I'm going to go into detail on each of those elements. So first of all, let's look at the age of onset requirement. And this requirement says that in order to be eligible to open an ABLE account, the individual's disability must have occurred before the date on which the individual attained age 26. So that's, you have to have become disabled before your 26th birthday. That does not mean that the individual has to be under the age of 26 to open an ABLE account. That, a lot of people are misinterpreting that. You can be 35, 40, 50, whatever, to open an account. It's just that you have to have become disabled before your 26th birthday. And it does not mean that you have to have necessarily had a formal diagnosis prior to your 26th birthday, but you're going to have to be able to show that you have a disability that occurred before your 26th birthday. And you will have to have a physician's signature and diagnosis, but we'll get into that later on. And the age of onset requirement is one of two requirements that must be met. Severity related to disability. And so in addition to the age of onset, you also have to meet the criteria related to severity. And you can satisfy this requirement in one of two ways. The first is being entitled to or a current beneficiary of the Supplemental Security or Income, or SSI program, or the Social Security Disability Insurance Program, or the other disability programs in the Social Security Title II program. And I mention that because there are things like the Disabled Adult Child eligibility under Title II of the Social Security Act. Or secondly, as I mentioned before, submitting a disability certification to the satisfaction of the Secretary of the U.S. Treasury. And I point out that it is the Treasury, which is where the Internal Revenue Service is housed, not the Department of Health and Human Services, because the ABLE Act is a part of the tax code. This is not part of your typical Health and Human Services work. So every time it refers to the Secretary, this is about the United States Treasury and the IRS. So again, let's take a closer look at the disability certification, because this is where we get most of the questions, and it's a little bit different. I think SSI eligibility or Title II disability, SSDI, or disabled adult child eligibility is rather straightforward. You either have it or you don't. But the disability certification is one where people need a little bit more information. If you are not currently a beneficiary of either SSI or SSDI or other parts of Title II, depending on the severity of your disability, the individual may still be eligible to open an ABLE account through establishing a disability certification. So let's go further and look at those details. What is a disability certification? With respect to an individual, a certification, it is a signed certification, signed under penalties of perjury, again, to the IRS. This is as if you were signing your annual tax forms, by the individual or by, as Chris mentioned, any other individual establishing with signature authority over the ABLE account for that individual. And there are three things that you are having to show. The first is that you have a medically determinable physical or mental impairment that results in marked and severe functional limitations, and that it can be expected to result in death or has lasted or can be expected to last for a continuous period of at least 12 months. Now, don't be alarmed by that language. Don't be alarmed by that definition. It's not as bad as it sounds. This is essentially the Social Security definition of disability without the substantial gainful activity test. It's actually lifted right from the childhood definition because that's where the language of marked and severe functional limitations comes as a replacement for the substantial gainful activity test. So the language of can be expected to result in death or has lasted or can be expected to last for a continuous period of not less than 12 months is in the law regarding eligibility for SSI and Title II already. So it sounds alarming, but it's already there, and people already meet this language. So that's the first thing. You're basically saying, I have a disability that meets that criteria, or you are blind within the meaning of essentially what is defined in the SSI program, Section 1614 of the Social Security Act. So you have to either show that physical or mental impairment or blindness that meets that criteria. So that's the first step. The second part of it is that such blindness or disability occurred before the date of your 26th birthday. Again, that's the 26th birthday thing. So you meet the disability test that essentially equates to Social Security's higher standard, and you had it before your 26th birthday. And the person must declare that you have a diagnosis signed by a physician that is relevant to the impairment or impairments that you are claiming. So once you delve into it and pick apart the pieces of this certification, it's rather straightforward. It's just a way of saying if you're not using the Social Security or the SSI disability programs at this time, we want to see that you have a fairly equal level of impairment and that you are, and that there is someone else who agrees that you have a fairly equal level of impairment, and that you also, just like everybody else, had it before age 26, and that you are swearing under penalties of perjury that you have that. So those are the elements of the certification. A couple of other things that relate to that are that the Social Security Administration has a process called compassionate allowances, which allows them to make some decisions move a little more quickly through their system. And for the disability certification process, Congress indicated that conditions that are listed on the list of the compassionate allowance conditions that is maintained by the Social Security Administration are deemed to meet the requirements for filing of a disability certification for the ABLE program if the condition was present before the age of 26. So if that's an additional way to sort of speed this along. I will note, however, that many of the conditions that are on that list actually are adult onset conditions, so that's just a reality. But if you have one of those conditions and you can identify it and it was there before age 26, then that will assist in proving the certification. And then the IRS, as of December 28th last year, 2016, put out a guidance to the states that people who are using the disability certification would not have to file their diagnosis with the state ABLE program. They would have to they would have to indicate that they have a diagnosis with a physician's signature, and they would have to, likely be asked to sign under penalty of perjury that they do in fact have that disability and that they are prepared to submit the documents if requested, but they would not have to file it when they are actually applying for the first time. There is an issue here, and perhaps our panelists who come after this will be discussing it, about privacy and also the fact that the state ABLE programs are simply not able to collect and store lots and lots of medical information in their files. A little bit more information. When an individual is determined eligible, that determination is for each taxable year, and that determination applies for the entire year. However, the regulations do allow a qualified ABLE program to choose different methods of ensuring that a beneficiary status remains, that the person remains disabled, and can impose different kinds of recertification requirements for different types of impairments. So that is in the regulations as they are being used, and we'll have to see how that plays out. And they do put in a sort of a, I guess I don't know what I would call it, but they do put in a line that indicates, and this is in the law, that no inference can be drawn from a disability certification for purposes of establishing eligibility for benefits under any of the titles of the Social Security Act. So even though you come up with a disability certification, it says you believe you are disabled and you have a physician's signature and a diagnosis, and you meet all the tests of before age 26, et cetera, that does not necessarily make you eligible for SSI, SSDI, or Medicaid. So just to put that on the table, and that was also in the law. And then there are some important protections for the account and for the individual. If the individual, and we know that this happens because some impairments are intermittent, if the individual for a period of time no longer meets the definition of eligibility, then there may be a taxable year when that person is not considered disabled. So for that period of time, the regulations set forth that the account, however, will continue to be an ABLE account, and the person, the designated beneficiary, will continue to be the designated beneficiary. And the ABLE account will not be deemed to have been distributed. However, during that period of time when the person is not considered disabled anymore, no new contributions can be made to the account, and no amounts that are spent will be considered qualified disability expenses, and that's really important. So if the designated beneficiary again becomes eligible as a disabled individual, new contributions may again be made to the account and accepted, and expenses that are incurred that meet the definition of qualified disability expense will be considered qualified disability expenses. It seems complicated, but it's intended to be user-friendly. It's intended to preserve the account during periods of non-disability so that an individual wouldn't have to spend down the account if they become disabled again and have to spend it all the way down only to build it back up again if they become disabled and need to use these programs again. So it's actually very disability-friendly. It may sound more complicated than it is, but it is intended to be very much a protection for people with disabilities. So let's change gears for a minute and talk a little bit about federal benefits and ABLE funds, and then we'll be able to move on to our other panelists. So federal benefits and their interaction with ABLE funds. The funds that are in ABLE accounts are intended to supplement, not supplant, benefits provided through other sources, such as private insurance, the Medicaid program, the Social Security Act, supplemental security income, Social Security, disability, the beneficiary's employment, and other sources. The funds in an ABLE account are not to be taken into consideration when determining eligibility for federally funded programs that are means tested. Those are the programs that look at how much money you have as income or how much money you have as resources, with one important exception, and that relates to beneficiaries of the Supplemental Security Income Program, and only when the account exceeds $100,000. Now, I think some people bristle a little bit over the fact that SSI is being treated differently, but just think about the difference between the normal $2,000 limit on SSI versus this $100,000 limit. So let's take a closer look at that. How do ABLE account assets impact eligibility for federal benefits? Again, the ABLE assets and disbursements, or you could call it expenditures or spending from the account for qualified expenses, will be disregarded or receive favorable treatment, is another way of looking at it, when determining eligibility for most federal means-tested benefits. We probably should say all there, but we have tended to be a little careful on the use of the word all because as people know, it's going to take a little while for all the federal benefit programs to come into line. But the special rule for supplemental security income is that only the first $100,000 in the ABLE account will be disregarded. However, if you reach that $100,000 point, when the balance goes over $100,000, SSI payments, the monthly cash benefit itself, will be suspended, not terminated. And the SSI benefit or eligibility will not be terminated. Funds above $100,000 will be treated as resources. And just as an example, what does that mean? Well, let's say the only money you had was in your ABLE account. So $100,000 would be exempt. And let's say you only had $1,500 that went over the amount, and you didn't have any other money. So you still have your $2,000 resource limit for SSI, and you have not exceeded that $2,000 resource limit, so you may still be in a protected area. So there's a little bit of room to work with that. There's a lot of detail that has to be worked out, and the Social Security Administration has issued what they call POMS, Program Operations Manual System, guidance to its staff on this, which would take almost an entire webinar to go over to deal with some of that. But just recognize that it will take a while for people to reach that $100,000 level at the $14,000 a year contribution limit. So we will have some time to work on those things anyway. One last point I want to make, and that is that the SSI special rule does not affect Medicaid, and this is an area where a lot of people have some confusion. Although many individuals will have to pay attention to the SSI rule anyway when they are on Medicaid. For Medicaid, all ABLE assets are disregarded in determining Medicaid eligibility. Medicaid benefits are not suspended if the ABLE account balance exceeds $100,000. There is, however, something known as, I think we need to move the slide, thank you. Yep. Medicaid benefits are subject to something that we call the Medicaid payback, but the statute actually calls it post-death payment. And this is that any assets that are remaining in the ABLE account when a beneficiary dies are subject to outstanding qualified disability expenses. So any assets left over, and once any outstanding disability expenses have been paid, what's remaining can be used to reimburse a state for Medicaid payments made on behalf of the beneficiary, but after the creation of the ABLE account. They could be made. The state would have to file a claim for those funds. Now, there has been a lot of concern about this provision. I would say that this is also the case for first-party trusts. This is not an unusual provision, and I would encourage people not to be discouraged by this if you're considering an ABLE account. Remember that the Medicaid program is intended for low-income people, and that sometimes the supports provided to individuals through the Medicaid program can run as high as $50,000 to $100,000 a year, even in living in the community, depending on your level of need. And that from a public policy perspective, allowing the individual to continue to have access to a significant amount of funds during life, that the payback of any excess left over at death is a reasonable request for that significant amount of funding available. Otherwise, without a certain amount of trade-off here in terms of public policy, we perhaps would have been left with the $2,000 limit per life. So that's what I had to say, and I'll turn it back to Chris. Thank you.
Okay, great. Thank you so much, Marty. Yeah, I know that, believe it or not, these accounts are actually much more easily accessible than you might think, but we did want to get into the weeds just a little bit to make sure that all the information that is available about eligibility is out there. What I want to do now is just kind of take a lot of that information that we went over, and I know that was kind of dense, and we put together some profiles of individuals who might be interested in opening an ABLE account, stating some of their characteristics and then explaining why they are either yes, eligible to open up an account, or no, not eligible to open up an account. So let's start out with our friend Jack. So Jack is 43 years old. Jack has a diagnosis of ALS, or Lou Gehrig's disease. Jack is a current beneficiary of SSDI, which is Social Security Disability Insurance, and Jack first began to experience symptoms of ALS when he was 34 years old. So the question is, based on those characteristics, does Jack meet the criteria that Marty went over to establish or to begin an ABLE account? And the answer is no, Jack is not eligible based on those characteristics, because while Jack does have a disability that could in fact meet the severity requirements, and Jack is a current beneficiary of SSDI, unfortunately Jack did not experience symptoms, did not have an onset of his ALS until age 34, which is of course after age 26, and therefore he would not be eligible to open up an ABLE account. Now, it is worth mentioning, and we're going to talk about this a little more in a few slides, that there is a piece of legislation that is currently in Congress that would raise that age from onset from 26 to 46, and we'll talk about that in a little bit. So let's move on to another profile, our friend Mary. Mary is 8 years old. Mary is a person with Down syndrome, and Mary is currently a beneficiary of SSI, Supplemental Security Income. Based on those characteristics, is Mary eligible to open up an ABLE account? The answer is yes. Why? Because she is currently a beneficiary of SSI, so she meets the severity requirement, and Mary is age 8 and has Down syndrome, a disability that we know starts at birth, so clearly before age 26. So therefore, she does in fact meet the eligibility, and Mary or her parent could set up an ABLE account on her behalf. Moving forward to John. John is 22 years old. John has a diagnosis of CP, or cerebral palsy. His impairments related to his CP have been recognizable since birth. John has a job, and the amount of income John receives actually disqualifies him from SSI or SSDI, so he's not receiving benefits through the Social Security disability programs. But John is using a disability certification, stating all those things that Marty had gone over. So is John eligible to open up an ABLE account? The answer would be yes. Because he had an onset obviously before his 22nd birthday as described in his characteristics, and while he is not currently a beneficiary of Social Security disability benefits, he does have a disability certification meeting the criteria that Marty discussed, so he can move forward in terms of opening up an ABLE account and begin to save in a tax advantage savings account for the purposes of offsetting whatever his disability-related expenses might be. Next, we want to talk about Sally and Sue are identical twins. Both Sally and Sue had the same medical history up until their accidents, and neither had a disability. Unfortunately, they were involved in 2 separate car accidents taking place at 2 separate times. Sally was paralyzed in a car accident a day before her 26th birthday and was paralyzed in the car accident, and Sue was paralyzed in a car accident a day following her birthday. Both Sue and Sally have a disability certification signed by a doctor stating how their paralysis caused marked and severe functional limitations. However, since Sally had a disability which onset prior to her 26th birthday, she would be eligible to open up an account, whereas Sue, who had her accident and obviously the onset of her disability after her 26th birthday, would not be eligible to open up an account. So it's important to understand that very important differentiation with respect to the point in which the onset of the person's disability occurred, despite the person perhaps being above the age of 26, as long as they had an onset of disability prior. So it really has nothing to do with the severity in terms of a person could suffer a disability or could encounter a disability, I should say, after age 26 that could have the same severity as somebody that encounters it prior to 26, yet they would still not be eligible to open up an ABLE account. So lastly, Anna. Anna does not have a disability of any type, but likes the idea of having a tax advantage savings account because her friend has one. Anna is clearly not eligible to open up an ABLE account since she does not have a disability, so would not be eligible. So again, not just anybody can open up an ABLE account, and having a disability in and of itself does not qualify one to have an ABLE account. So it's important to understand the requirements and criteria that need to be met in order to be allowed to have one of these types of accounts. So just very quickly, we did spend some time talking, and we often get a lot of questions about this age 26 onset, and it's important to note that there is, like I mentioned previously, what's called the ABLE Age Adjustment Act that has been filed in both chambers of Congress, both in the House and the Senate, that would allow the age of onset to increase from age 26 to age 46, which would allow a significant number of additional individuals with disabilities access to these ABLE accounts to help them save for the purposes of offsetting their disability-related expenses. As many things are related to Congress, we do not know in terms of a timetable when that will actually, or if that will actually be passed. But there are a number of disability-related organizations here on the national level and on the state level that are advocating for the passage of this bill, again, so that more folks with disabilities who meet those criteria can be eligible to open up accounts. So with that, I want to kind of get some perspective of folks that are better acquainted with these programs on the ground. And I want to start out first with Kathleen McGrath, who is the founder of KF McGrath LLC and is the former director of the Pennsylvania ABLE program, to give us some perspectives on some of the things that we discussed today, including both some of the unique things that have been going on in the state of Pennsylvania with respect to the Medicaid payback provision that Marty described, and with respect to some of the things that we talked about in terms of if the person themselves, if the beneficiary themselves either doesn't have the capacity to open an account or perhaps wishes to have somebody else open the account, what does that look like? Who's allowed to have that, and does that change from state to state? So with that, Kathleen, I appreciate you offering us your time and expertise. What are your thoughts on these different topics?
Thank you, Chris. I'm really honored to be part of this because ABLE is a passion of mine. I think it's one of the best things that government is doing for people. Let me first address some of the eligibility points that were made earlier. He did a great job covering eligibility. So we know from Marty's presentation who is eligible to have an account. What I want to talk about a little bit is who can open an account on behalf of the individual who is disabled. So what the regulations say is that, let's say you're a child, you can have a parent or a guardian can open an account for a child. Now, typically what the states will say is if you're a parent of a minor child, you just need to self-certify that you are the parent and there's no questions asked and you can open the account without any further documentation. However, if you're the guardian, even of a minor child, some states, though not all, are requiring you to submit the actual formal guardianship papers. Some states will require that. Some states won't require that. But if the situation is even a little cloudier when the disabled or the individual with disabilities is already an adult. Let's say the child was born with Down syndrome, they're not capable of handling their own finances, and the parent has been taking care of their finances throughout the person's life. The person is now 25 and the parents want to open an account for that person's benefit. Now remember, as Marty said, the account owner and the beneficiary are both the same person, and that is the individual with disability. So what we're talking about here is not who owns the account, but who could act as a signatory on the account. In that case, if the account hasn't been established yet and the person with a disability is an adult, a lot of states will require a formal guardianship, and they will require that you submit the guardianship papers. Other states will, again, based on the regulations that the IRS has put out, will say being a parent, even of an adult, is enough and will allow you to open the account without going through the formality of a guardianship. So that varies state by state, and that's something that I would encourage individuals who are considering opening an account to look into. The other thing that I think people should really be aware of if they're opening an account for a minor is what happens when that minor becomes an adult. Does the account automatically come under the control of the person with the disability, so they would have full access to the full amount in the account and could spend it any way they want? Or does the person who had the original signature authority have some control over that? And again, states are doing very different things here. Some states are saying, okay, we're going to stop, we're going to sort of freeze the account until we hear who has the authority. Other states are allowing the person who opened the account for the benefit of the individual with disabilities to continue having signature authority over it until they are otherwise notified. So again, I urge people who are opening accounts to look ahead and see what will happen when the individual with disabilities does become an adult. The other thing I want to emphasize is the diagnosis. States do not want to have any medical information. They don't want to be responsible, don't have the capability of storing in a confidential way or the HIPAA kind of requirement. So typically, as Marty said, they will not require even the written diagnosis from the physician. You will be required to have it, to maintain it, put it in a safe place, make sure if you're ever asked you have it, but most states will not require you to submit it. What they will require, however, and this the federal government mandates, is that when you fill out the enrollment form, you indicate one of 7 different codes that do indicate the disability. And I'm not going to go over all 7 of them, but they're very general: developmental disorders, intellectual disability, psychiatric disorders, etc. So all you need to do is check one of the boxes. Typically the enrollment form will have the boxes on them. You pick the one that is most like the diagnosis that you have and check that. That will be required because the states are mandated to let the IRS know that. Again, don't need any documentation, don't need the signed letter from the doctor, but do need the person who's opening the account to indicate that. So those are the couple of points that I wanted to mention with regard to eligibility. The other thing I'd like to talk about is the impact on benefits, and particularly the Medicaid payback provision that Marty referred to. So the first thing I think that people need to understand is the general rule on paying back Medicaid. And I'm not an expert on that, but what I understand is that generally speaking, not counting ABLE, but just generally somebody who's received Medicaid benefits, the federal government requires that state governments seek repayment of those situations from the estate when the person receiving Medicaid benefits dies. But it's limited. They require seeking repayment only when the individual who dies is 55 or older when they die, and only for the benefits paid at age 55 or older. So it's more limited. Now layer on top of that what the federal ABLE law says. The federal ABLE law says that a state may, doesn't have to, but may make a claim against the ABLE account for the amount paid for a deceased person who was on Medicaid and had an ABLE account. They can make a claim for the entire amount of Medicaid paid during the time that the individual had the ABLE account. So if an ABLE account was opened for a child at age 7 and the child died at age 27, any medical assistance received during that period of time, the state agency could, doesn't have to, but could seek reimbursement. And again, as Marty said, the first thing is you pay out of the account any eligible expenses that are still outstanding. So those should be paid first. So you can imagine that some state ABLE agencies were not very happy with this provision of the ABLE Act. So some states, and I think Pennsylvania was the first, actually passed in its law a prohibition against its own state going against the account, the ABLE account, or the proceeds of an ABLE account. That law did pass, and so in Pennsylvania, the state agency will not go against the ABLE account under the ABLE law. However, they are required by the general Medicaid law to go after the amount when it hits the estate and the individual is 55 or older. So Pennsylvania gives its residents some protection. Now, other states are looking to do this. I think 2 other states have already passed laws similar to Pennsylvania. That's Delaware and Oregon. Other states are looking to do the same, and there is some effort to address this at the federal level. So just is, again, something to be aware of, and, you know, you go into this with your eyes open knowing that this is a potential, and wherever state you live is the state that's going to control whether they can go after the ABLE account. So it's something that you should look into. The last thing I'd like to point out with regard to impact on federal benefits is that while the law is very, very, very broad and says that your ABLE account should have no impact on any federal benefits, with the minor exception, not minor, but the exception of SSI as was explained by Marty, we are hearing that some federal agencies are counting them. In our opinion, they should not be. One particular agency that we've heard of is HUD. And what I would do is encourage anyone who opens an account or who has an account and is hearing from their local HUD agencies that their assets in an ABLE account will be counted, is to make sure they give their state ABLE program a call and let them know that that is happening and being threatened, and the state agency, the ABLE agency, should be very interested in dealing with that situation. So that's what we're hearing out there in the real world. I'd be glad to take any questions when that's appropriate. Chris, thank you very much.
Great. Thank you so much, Kathleen. Yeah, and I think you bring up a good point about those, what we've been hearing in terms of HUD benefits. I know that both our organization, National Disability Institute, and the ARC, and several other organizations are encouraging all federal agencies and departments that provide for means-tested benefits to, as quickly as possible, put out guidance reaffirming that funds in an ABLE account will not be taken into consideration for that particular department's federally funded means-tested benefit. But as you can imagine, this is taking some time, but we are expecting to see guidance out of these various federal agencies, including HUD, including CMS. I believe the SNAP Agriculture just came out with their SNAP guidance saying that funds will not be taken into consideration for SNAP benefits and things like that. So we are certainly aware of that, and we're doing our best to, again, make sure that those federal agencies understand the law and then reaffirm so that folks can feel comfortable getting into these programs. With that, I'm going to turn it over now for Rob. Rob represents a census, and he's going to tell us a little bit about what a census is, how they got involved into the ABLE space, and then give us some perspective on what enrollment and eligibility, enrollment related to eligibility or eligibility related to enrollment looks like for the programs that a census has a part in. So Rob, go ahead and take it away.
Great, thanks Chris. Hi everyone, my name is Rob Percival, and I oversee the ABLE product offerings here at Census College Savings. We're a program administrator for both 529 college savings plans and ABLE programs, and we partner with many states and business partners to administer 14 different state ABLE plans, performing various administrative functions for those. So as it relates to our participation with ABLE plans, here at Census in our role as plan administrator, we're responsible for capturing an account owner's disability type, as was mentioned previously, whether people are enrolling via paper or online, as well as the basis on which they meet the severity requirement. So capturing the disability type, as was mentioned earlier by Kathleen, is something that's required by the IRS and that is captured by them and really only used on an aggregate basis for reporting purposes. As far as the severity requirement goes, we are capturing the items that Marty had mentioned as well, specifically either being entitled to SSI or SSDI benefits or claiming a disability certification. And as was mentioned earlier as well, for people who are claiming a disability certification via paper application, we're requesting that they do not send in any medical or health-related documentation, as we're not equipped to handle that via the HIPAA requirements, but to be sure to retain that documentation in their files in the event that they are asked for it. And a couple other points that I wanted to make was that, when we talked earlier about, Marty mentioned the annual recertification requirement that an account owner has. That's an important one, and we obviously want to make sure that we work with our states and partners on their plans to ensure that folks are observing that obligation. So we do a couple of things. We include reference to that obligation, their obligation to do an annual recertification of their eligibility, along with the program disclosure documents that we provide for the plans that we administer. So that as people are reading those documents, essentially the offering document for the plan that they're going to invest in, we make sure to include that in there so that they're aware of that obligation before they sign up for a plan. And then we will also be taking steps to send annual reminders to account owners or to those who opened up the account on their behalf to ensure that they are reminded again that they do need to let us know if at any point they no longer are eligible, an eligible individual for an ABLE account. And as Marty mentioned, if they do let us know that they're not eligible any longer, what we'll be able to do on our side from an administrative standpoint is just put a hold on their account that restricts them from contributing to the account during the period that they're not eligible, and in the event that they later become eligible again, we're able to unblock that so that they can then continue to make contributions in as a qualified individual. So we've got some processes in place there from the administrative perspective. So we just wanted to point that out. Those were the kind of the main points that I wanted to make, Chris, unless there's anything else that you wanted me to touch upon, and certainly can answer questions at the appropriate time.
No, that sounds good. I wanted to touch on quickly to get your perspective. Marty had mentioned, I know that this is something that's we've been getting a lot of questions out in terms of that one exception as it relates to folks that are ABLE account owners and also beneficiaries of supplemental security income. and how those benefits, that cash benefit provided through SSI, would be temporarily suspended in the situation in which the account goes over $100,000. Now, we all know that it's going to take some time for anybody to get up there, but are ABLE programs planning to alert a beneficiary if their account starts to creep up on that particular limit so that they can make a decision as to what they want to do with those funds?
Sure, that's a great question, Chris. And yeah, obviously, given the current annual limits, it'll likely be some time before we start to encounter these situations. But we do intend to have practices in place where a reminder would go out, and these would be depending on the plan and the state. You know, those aren't things that are required per se, but we would work with our states and partners to determine, you know, the best way to approach that, and whether it's at 90,000 or some other number that kind of triggers an automated notification to let folks know that, you know, hey, to the extent that you do rely on these benefits, the SSI benefits, this is a reminder that your account is getting close to that limit, so that we let them know, because in certain cases they may not be paying very close attention. They may be fortunate enough that, you know, friends and family have been contributing to their accounts, and that balance may be creeping up. So we would intend to provide a reminder there to folks. And again, this varies by plan to plan, but from a census perspective and the plans that we administer, we'll be working with our states and partners to implement such a reminder. And then, you know, beyond that, I think, you know, really there's nothing that we would control on our end in terms of those benefits being suspended. That's something that the Social Security Administration would be checking on those balances, and they would be administering it from that end.
Right, right. Yeah, and I think it's important to reiterate that even under that circumstance, an individual's Medicaid would stay intact despite the fact that their SSI cash benefit may be suspended when that account breaches the $100,000. It's also important to note that not everybody who has an ABLE account or is able to have an ABLE account will actually be a beneficiary of SSI. As Marty stated, they could be qualified through SSDI, or they could be qualified through a disability certification, in which those folks wouldn't have to take anything into consideration with respect to that $100,000 cap. So I think folks need to understand that as well. I want to touch on a couple questions just very quick. Yeah, go ahead.
This is Kathleen. Just so folks know, the SSA will be advised of the balances from the state agencies. State agencies are required on a monthly basis to submit data to the Social Security Administration, including the account balance. So that is how the Social Security Administration will know whether it should be suspending benefits or not.
Gotcha. Thank you. Yeah, that's a good thing to know. I want to just touch very quickly. We only have a few minutes on some of the questions that have been submitted. One person asks, when you say the word tax year, is that January to December or April to March? So when we say things related to a tax year, we're talking about January 1st to December 31st. Another question is, my disability occurred at age 19, but I started SSDI at age 31. Can I still qualify? The answer is yes, as long as you had an onset before 26. It doesn't necessarily have to be the severity in which would qualify you for Social Security disability benefits, from what I understand. But you had to exhibit symptoms or conditions related to your disability. Would you agree, Marty, or am I getting that wrong?
I don't know. I don't know how far they would go with that. I think it's supposed to be a severe disability at that level, but I don't know that that equates to not having received benefits at that age. Yeah. So my answer would be, if you had the disability at age 19 that was that severe, yes, you would qualify. Oh, yeah. Whether or not you decided to apply for disability benefits at that age is a different question. But if the disability wasn't severe enough at age 19 but became severe after age 26, that's getting into extreme gray areas, which could be resolved if we got the bill changed. I mean, if we got the law changed to extend the age. But that's true. Yeah. Not totally resolved, but better for a lot more people.
True. Another question is, can the leftover funds be transferred to another family member who qualifies for an ABLE account? So as it currently stands, the only clean transfer in terms of family members is from one qualified sibling to another qualified sibling, and the way that it's currently written has to be within the lifetime of the original beneficiary or the beneficiary that's transferring. So unfortunately, if that person was to pass away, they would not be able to have a clean transfer because those assets in the ABLE account would be subject to that Medicaid payback, provided that there's no other laws, state laws, that prohibit it from doing so. We are just at 3 o'clock, so we're going to go ahead and wrap up. I just wanted to say again thank you to our guest panelists, both Rob and Kathleen, whose information is up there, as well as Marty's. I appreciate everybody tuning in today. We have a lot more questions. We're going to take these questions and take a look at them, kind of categorize them, and address them hopefully through the ABLE National Resource Center website. On the next slide here, we have information just very quickly about next week's webinar, which will concentrate on exactly what ABLE funds can be used for. That will be taking place Wednesday, August 16th at 2 p.m. And you can go to our website, www.ablenrc.org, for information on how to register for that webinar. So we hope to have everybody back again on Wednesday for more information on a new topic. And until then, have a great rest of the week. Bye-bye.